I'm Ruth Ann Cabria, and I'm here to present to you the geographical analysis of healthcare facilities in the Philippines. First, let me share with you a patient's journey. The patient was rushed to a Hospital A, where they found that the patient suffered stroke and aneurysm. However, Hospital A cannot perform the surgery, and they recommended Hospital B. However, in Hospital B, the surgery cost 500,000 pesos. The patient doesn't have that amount of money. Good thing, there is a government hospital C in Manila, 25 kilometers away, where the surgery costs 180,000 pesos. But before the surgery, the patient has to go to Hospital D for a laboratory test that is unavailable in Hospital C. The patient waited in the hospital's hallway, pre and post surgery, because there's no room available. That was the story of my relative last February. And so I asked, what is healthcare accessibility really? According to the World Health Organization, accessibility in healthcare is the availability of good health services within reasonable reach for those who need them. And so I categorized accessibility into three types: distance, duration, and affordability. First, let's look at the Philippine geography. The Philippines is grouped into 3 islands: Luzon, Visayas, and Mindanao. Sorry. Sorry for that. So the Philippines is grouped into 3 island groups: Luzon, Visayas, and Mindanao. It has 17 regions, 81 provinces, 7,641 islands, and 42,000 barangays. And on the graph on the right, you will see the rural distribution by population of each region. So you can see that the Philippines is a heavily rural country. So the top 5 rural regions are Region 8, Region 2, Region 1, Region 5, and the ARNM. So where are the healthcare facilities? According to the National Health Facility Registry, there are 30,637 registered facilities, of which 23,000 are barangay health stations, 2,500 are rural health units, 2,100 are birthing homes, and 1,380 are hospitals. So the question now is, do we have enough hospitals? 1,380 hospitals for 109 million Filipinos. That gives us 79,000 Filipinos sharing one hospital. But according to DOH Administrative Order 2006-0004, the recommended bed to population ratio is 1 to 1,000. So hospital levels are based on the DOH guidelines, level 1, 2, and 3. For level 1, there are no ICU. Level 1 hospitals should be able to provide minor care and supervision and minimum healthcare services. For level 2, it has ICU and with specialist doctors. And for level 3, it has additional training program for doctors, rehabilitation facilities, and dialysis units. So here are the hospitals in the Philippines. 67% are private. 45% of the hospitals are in Luzon, particularly in NCR, Region 3, and Region 4A. And 48% of level 3 hospitals are in NCR. 3 out of the 17 regions do not have the level 3 hospitals. So comparing urban versus rural, I selected 1 highly urban region, which is NCR, and 3 rural regions from Luzon, Visayas, and Mindanao. So as you can see, for NCR, there are 197 hospitals, 146 of which is private. And for ARMM, there are 30 hospitals. 22 of which are government. So we can see that the distribution of hospital per population is really huge. For NCR, 65,500 share the hospital, but for ARMM, 127,000 people share one hospital. So comparing urban and rural in accessibility in terms of distance and duration. So what I did is to generate the lat long of the hospitals using Google Maps Places API, get the nearest hospital per barangay centroid, generate the distance and duration using Google Maps Distance Matrix API. So as you can see in NCR, the median distance of one barangay to a hospital is 1.1 kilometers with a median duration of 5 minutes. And the maximum hospital distance of a barangay to a hospital is 8 kilometers. Whereas for Region 2, the maximum is 301 kilometers and the median duration is 7 hours. As well as for Region 8 in the ARMM, the median distance is 14.8 kilometers and 10.4, and the median duration is 25.26 minutes, with a maximum duration of 3 hours and 27 minutes, and 3 hours and 24 minutes. So public healthcare is really under-resourced and thus often of poor quality. Despite having the universal healthcare, we cannot guarantee the quality service for all Filipinos, given the huge disparity between urban versus rural communities. So the question now is, should we add more hospitals? Maybe not now, due to the following reasons. First is the shortage of medical professionals. Clearly, we do not have enough medical professionals to man the hospitals. Next is the existing hospitals do not have enough supplies and equipment to provide quality health service. And addition of private hospitals may not improve the situation, especially in rural areas due to cost. Lastly, insufficient DOH budget from the government to sustain the existing healthcare needs of the population. So what can the government do? I highly suggest that every region has level 3 hospital to train our future doctors, and for DOH medical scholarship to include more scholars coming from rural regions. Lastly, for the government to ensure each hospital can produce quality service by providing sufficient medical supplies and equipment. And what can we do as a community? I really believe that we have a moral obligation to be the voice of those silenced by poverty. So let us continue to seek accountability from the government regarding the healthcare system in the Philippines. If the government can spend on Dolomite, they can spend on saving people's lives. Thank you.